Good afternoon. Advanced Clinical Practice students and non-medical prescribers Emma Breen, Angela Henaghan and Sue Stubbs collaboratively working on a service improvement project, the aims of which are to enhance the decision making for prescribers of antibiotics for acute sore throat within a nurse-led urgent care through education, reflection and a structured decision support prompt checklist. The chosen topic of sore throat presentation, which is very common within urgent care, whilst inappropriate prescribing remains a key driver of antimicrobial resistance. Variations were identified in prescribing decisions amongst colleagues who utilised existing support tools, for example, fever pain or centre scoring, alongside NICE guidelines and their clinical judgment. We aim to increase awareness of cognitive bias, thus improve confidence in decision making and prescribing or non-prescribing through a shared decision making approach. The Plan, Do, Study, Act framework was utilised to structure the project. Due to audit restrictions identified during the planning stage regarding clinical notes, the staff pre-implementation questionnaires and interviews were included to measure confidence levels in prescribing, cognitive bias awareness and shared decision making with patients. The educational session consisted of both teaching and interactive discussion which reviewed current guidelines, tools, the concept of cognitive bias and the introduction of a prompt checklist. The session was recorded and available online for staff to access on Teams as required. The prompt sheet was to be used for all presentations of sore throats, supporting clinicians to analyse their thought process and decision making, including bias, encouraging patient participation and shared decision making. Follow-up was undertaken 8 weeks later through a mixed approach of self-evaluation questionnaire or interview, which we acknowledge can be subjective. The feedback questionnaires were correlated and predominantly positive comments highlighted perception of improved confidence, recognition of cognitive bias and increased shared decision making, the expectations of patients' treatment and the pressure felt by practitioners to prescribe antibiotics was a repeated aspect highlighted. Time limitations also factored into feedback, whereby high patient numbers, clinicians felt pressured due to time constraints. Finally, ACT. We wish to implement the prompt checklist and repeat a further cohort of staff to shorten the questionnaire, although it is acknowledged that results would be more reliable if they included a formal audit of notes that would improve validity but difficult to achieve getting approval. We felt it important to share the exploration and outcomes with our local trust antimicrobial prescribing group and currently seeking to liaise with research champions locally. A further study would be most beneficial. Thank you for listening.